So, Minister, when I was setting the scene, they had a specific question to say, what does that mean for South Africa that the US has withdrawn aid funding to particular programs? What are the implications for South Africa? And I want you to start there, and then we'll take questions from the media, and it's only going to be 5 questions, so that because you're still going to brief the Lekgotla on the matter.
Yeah, thank you very much, Minister. Thank you very much, ladies and gentlemen of the media. As you know, in our population of 63 million people, 7.8 million people are infected with HIV and AIDS, of which 5.5 million are on ARVs. Now, where does PEPFAR come in? As you know, we have got 52 districts in South Africa. PEPFAR chose 27 of the most affected districts. That's where they are, meaning in the other districts, they are not there. They are only in 27. And these 27 districts are only in 8 provinces. As I said, they are choosing in terms of the load, the burden of HIV/AIDS. So the only province that's not there is Northern Cape, because it does not have any district that is highly affected by HIV/AIDS. Not that there's no HIV/AIDS there, but they gauge. Now, in the districts, the 27 districts, 7 of them are in KZN. For very obvious reasons, we know KZN is highly affected. 5 of them are in Eastern Cape. 4 of them are in Gauteng, and 3 in Mpumalanga, 3 in Northwest, 2 in Limpopo, and in Western Cape is only the Cape Metro that is in that group. So it's a total of 27, and obviously the 0 is Northern Cape. Now, the total number of people on the ground who are dealing with HIV/AIDS in those 27 districts, the total number of people is 271,000 people, 271,606 to be exact. Those are the people on the ground every day who are fighting HIV and AIDS. Now, out of that number, 256,452 are funded by us as South Africa. And I want to repeat the numbers because it's very important to understand. We have got an army of 271,000 people, 606, on the ground in the 27 districts fighting HIV and AIDS. 256,452 are funded by us as South Africa from our own fiscus. That leaves us with 15,145 people. Those are the ones who will be affected by whatever withdrawal is there. Now, how is the funding conducted? 76% of the funding is from South Africa, 76% of the funding. 74% by the government, fiscus, and 2% by the private sector. That includes medical aid. All the medical aids in the country are contributing 2% to the fight against HIV/AIDS. Otherwise, the rest is government. Now, obviously, as you can see, that leaves us with a gap. And that gap is filled by Global Fund, which gives 7%, and PEPFAR, which gives 17%. So when you add Global Fund and the government of South Africa, or the South African, either government and private sector, when you add them, you realize that is 83%. So PEPFAR remain with the 17%. That's where our problems are. Now, we are buying ARVs on our own with 10% from Global Fund, which is not affected by this. I'm sure you are aware. Global Fund is an international organization in Geneva. We are buying on our own. So our biggest problem will be the salaries and the operational costs of those people that I've just mentioned. That's what we are trying to look at with Treasury. We're supposed to have a meeting yesterday, which could not happen because they were preparing for this Lekgotla, as you'll understand. Lekgotla is mostly a Treasury thing. But they said we must write a dossier and send it to them. We have just finished that dossier. We have sent it to them, showing some of these things that I'm actually telling you about here. But up to so far, we haven't received any letter from the American government. This money, whether from Global Fund or PEPFAR, it comes through Treasury. Treasury has got no letter. Health has got no letter. DERCO has got no letter. Tried to contact the embassy of the US. We couldn't get them. So how do we know that there is this funding withdrawal and all that? Because the actual NGOs and the clinics that are funded from this PEPFAR were the ones who received letters, as you know. But this morning, we read again that the Secretary of State has withdrawn that for the time being because they say they are going to review for 90 days. So it's still a little bit fluid as to exactly which way are we going. But we believe for now, all programs continue. As South African government, one thing we want to ascertain is that nobody must stop taking ARVs, because that will be devastating. It will be completely dangerous. As you know what happened. When you are on ARVs and you stop, there will be serious trouble. Now, where are we in the battle? I'm sure many of you know that in 2014, UNAIDS adopted the strategy of 95, 95, 95. That of all the people who are HIV positive, 95% of them must know their status. And out of those who know their status, 95% must be on ARVs. And out of those who are ARVs, 95% must be virally suppressed so that they stop propagating the virus. So where are we? We are on 96, 79, 94. That means 96 of the people who are HIV positive, at least in our country, they know their status. But those who are on treatment, out of those who know their status, are 79%. And in that 79% who are on ARVs, 94% of them are virally suppressed. It means they can no longer spread the virus, reducing the number of new infections. So for us to reach this 95, 95, 95, which we are targeting to do by 2030, because we want to eliminate HIV as a threat to human health by 2030. So in order to do that, our calculation is that we need 1.1 million people. As you can see from the 95, the middle 95 is the one where we are very weak. That means the number of people who are on ARVs. So to reach that 95, we need 1.1 million people. On the 23rd, I think we are launching that program. We had a meeting here with the ambassador of PEPFAR, John Kingasong, UNAIDS, UNICEF. We had a meeting last year to plan for this, which we call Accelerator 2. So we are still going on with it because we want those 1.1 million people to be on ARV so that we reach our 95s. We obviously will be affected by this, but what we want to guarantee is that we don't want to find any single South African who is on ARVs, stopping them because of this decision from America. That will try by all means to stop. And we are lucky because, as I told you, the ARVs we are buying is from our own fiscus and from Global Fund, 10%. The rest, 90% is ours. Thank you very much.
Thank you, Minister. We'll take then the questions. Can I see a show of hands? You introduce yourself, the media house you come from, and then you say your question. Can I see? Going once? Moloko. I forgot her name.
Anastasia.
Anastasia. Nelly. Let's go in that order. So it's 4.
Minister Simbile said from Bloomberg News, what is the budget implication for those 17,000 salaries and operational costs? What would you be needing from the Treasury?
17,000.
17%.
Sorry, 17%. You said for the operational costs and the salaries. If we are to fill in that gap, how
It's
much?
4.6 billion.
Thank you.
Moloko.
All right, yeah, mine is very simple. Just to understand, as much as you are saying large part of the budget in regard to this HIV program comes from our own sources. But even with the tiny withdrawal, should the US continue not to fund us, how much of a setback will this be on the fight against the HIV?
It is, of course, a setback if people start talking their ARVs about that. But as I said, we've already had meetings with people who are officials who are running HIV and AIDS in provinces. We've had a few meetings with people living with HIV and AIDS as one of the 18 sectors of SANAC. We're discussing strategies. So it will be a setback if one person doesn't take ARVs because of this. The other setbacks, we'll try how to deal with it. Like I've already spoken about salaries. The 17% of PEPFAR is about 7 billion, you know. Or maybe I didn't give you the total amount which we are spending on this program of HIV. Those who were at Lituli House yesterday, I said it's 44.4 billion. I'm sorry, I'm apologizing. They gave me last year's figure. Now it's 46.8. It's 46.8 billion for now, and for the next financial year it's going to be 48 billion. I'm apologizing. Whoever gave me the figures gave me last for 23-24 financial year. Now I'm talking about 24-25. It's 46.8 billion. Now in that 46.8 billion, 17% of that comes from PEPFAR. The rest is us, as I've said, and Global Fund.
Madam Anastasia.
Anastasia Mkhubu for Jacaranda FM News. Minister, understanding that the review is going to take 90 days, which means there's still time to have conversations with other people, are there perhaps, outside of National Treasury, are there perhaps other NGOs that the government can approach to fund those clinics that are going to continue with the work? I know that vets did indicate that they're going to be closing the clinic and Men's Health in Joburg as well.
Look, there are many funders around the world, but the issue with funders is they choose a particular program. For instance, in health, Bill and Melinda Gates Foundation are also stars in that area, but it's only that they never entered this area. Most of our vaccines and research, and even now the TB vaccine research that is going on, which is likely to produce very positive results in 2027, is funded by Bill and Melinda Gates Foundation. So I'm just giving that as an example. We have got many other funders around the world. The question is, will they agree to enter this? For instance, Global Fund was specifically formed in Geneva for HIV, AIDS, TB, and malaria only. That's all they are doing. But you remember that during COVID, they agreed to fund us for oxygen, what you call that controversial program, which is still being investigated. It was a deviation from what they usually do. So we don't know whether when we speak to these funders and say, please deviate from this to HIV/AIDS, it's still very early days to tell. But at the moment, HIV is funded by PEPFAR and Global Fund.
Thank you, Minister.
Hi, Minister. I'm Nellie Payton from Reuters. You said that you don't want anyone to go off their ARVs, of course, but I'm just wondering, what is the risk of that in this interim term while the government is trying to find other sources of funding to make up the gap? In the next weeks, for example, are there people who could conceivably not be able to get their medication or not get follow-up services?
Well, I said when we met people who are running these program in provinces, we are trying to avoid that. If you look at the clinics run by vets, they've already called people to come and fetch their ARVs, waiting for these 90 days to give them all the supply. So, as I am saying, what we want to guard against is anybody not taking ARVs. And we think, I've already given you the staff that is on the ground. That is 271,000 people. And 256,452, they'll still be there because they are paid by our government. Maybe they'll just do more work, but 256,000 are there. The ones that may be affected if they have to stop is that 15,100 in those 27 districts. But remember, there are other districts in South Africa. We are not counting them here because PEPFAR is not involved. Those districts will be giving ARVs. They'll still be employing people. They'll still be doing everything that needs to be done.